Now we're going to speak to a Navy nurse who works on oncology floor. Hi, Lieutenant Fite.
Hi, Darryl. Thanks for having me.
Sure. Why don't you share with the audience, what you do and where you do it?
Sure. So I'm a Navy Nurse Corps officer, have been for almost the last 9 years. And currently I work at Naval Medical Center, Portsmouth, Virginia, where I'm an oncology nurse on the inpatient ward and serving as the clinical nurse specialist for that unit.
And is nursing something that you wanted to do as a young man growing up, and the Navy just seemed like the best place for that?
It is. I grew up a Navy brat myself and was always interested from an early age in going into healthcare. And growing up in that uh, environment and seeing that there was this great opportunity that I could both go into the profession I wanted to and to be able to serve those who serve in that way. Ended up being a great opportunity for me, and I've loved it ever since.
Great. Have you been deployed abroad at any time in your career?
Have not been deployed per se, but I did have an opportunity to participate in a humanitarian mission to Vietnam back in the summer of 2017. So that was a wonderful experience for me.
Excellent. So let's talk about the experience that men with cancer have under your care. When you meet somebody, I mean, are you introduced as their nurse, or how does that play out when you first say hello?
Yeah, when I first meet a patient and or their family members, I introduce myself as Lieutenant Fite, and I'm going to be the nurse taking care of you today or this week or so on. Or I'm one of the nurses who will be participating in your care while you're here with us.
And how does rank play out in that introduction? I mean, do you first salute if they're of higher rank and then enter conversation, or how does that work?
No salutes, but certainly we address, our patients by their rank. If they are a service member, veteran, retiree, and make sure that they're afforded all the common courtesies that customs and courtesies we would in any other environment. Absolutely.
Right. But you don't have to ask permission to enter the room, or, I mean, any more than, the usual knock on the door or anything like that.
Right, right, right.
Yeah.
Yeah.
Cool. All right. So what it sounds, I mean, in talking with doctors and nurses that work on base hospitals, it sounds like outside of the uniforms you wear, the visual experience and the conversations are more or less on par with a civilian hospital. Are there any actual differences that we're missing?
Well, I think whether it's a civilian hospital or a military treatment facility, patients should always expect to receive excellent care, no matter what kind of facility they're stepping into. But I think what sets apart when they come to receive care at one of our facilities is that they're already getting treated by healthcare professionals who share the common bond and experience of serving with them. So immediately we have something in common. We kind of understand, at least on a very base level, the experience that they and their family members have had or are still going through as active duty service members. So that connection is instant and very special, and something that they, might not have if they were to go to a civilian hospital.
Yeah, and you understand both the stressors and the work and also the good things, the camaraderie. Well, I mean, those are good
Right.
things in some respect, but you understand what it means to be in service.
Absolutely. Yes.
Right.
The stressors of moving all the time, deploying, just being able to take care of family on top of all that. And then the additional challenge of having a new diagnosis and understanding how their treatment will go and all of those types of things. So I think there's an established sense of trust almost from the get-go, and not to say that we don't have to earn that as well, but I think they feel well taken care of when they have other service members and people in uniform who are coming in and out of their room every day.
All right. And trust is a word that, or a value that we hear at Malecare like endlessly, almost 3, 4, or 5 times a week, and before COVID, 4 or 5 times a day. How do you generate trust? How do you use trust? How do you not abuse it and such? What are the conversations that you have or have had with patients that sort of reveal what that unique trust is like?
For us as nurses, I think it's that we so often are the constant with them and or their family members. We spend so much time with them, particularly in the hospital environment where I work. And so the repetition of seeing us, establishing that relationship with them, providing them with the education they need, getting their questions answered, following through on requests or clarifying things that they need better understanding of, ensuring that their symptoms are being well managed and controlled for them. All those little things add up as we develop our relationship with our patients, who we often will see, intermittently or sometimes continuously over the period of weeks to months.
Yeah. And, around trust also, there's this sense you're both in the same business, you're both comrades. In extreme circumstances, your lives may literally depend on each other.
Right.
Patients know that military healthcare providers are not going to spend an extra, trade off 5 minutes of your care time, the patient's care time, for 5 minutes more in the lunchroom. You're there to take care.
Right.
And it's interesting. Trust is almost like a contract in that construct, and a very tangible one. By the way, do patients can bring their own pajamas and such in a military-based hospital, or do you have to wear?
They can.
Okay.
Absolutely.
Right. It just occurred to me because everyone in care is wearing uniform or fatigues or something outside of when you're in an OR or special situation. Right. But patients don't have to dress up, right? Or uniform up. Okay. All right. So in a way, it's a bit of a vacation in that respect. Yeah. Okay. So, or also around trust. As you and others have said, you, as a nurse, you're answering questions. How does that? So in civilian life, people complain the doctor isn't spending enough time with me. I'm not getting my questions answered by them. I'm shunted off to an intern or somebody, the receptionist or whatever. What expertise and what authority and background do nurses have that may be unique to military service that gives you the capacity to answer questions with the same quality as a physician would?
Well, I think particularly, really with any specialty, in oncology, nurses who take care of our our patients have specialized knowledge of their field and the tools that they need to be able to deliver safe and effective care to the patients who were, especially those who were actively treating. But then to also be able to intelligently and adequately answer their questions. Now, of course, when it comes to questions that are more about, how a disease is treated or a particular procedure that is performed by a physician, that's absolutely their expertise. But questions about a disease or about the type of treatment that we're giving for it, side effects, what they can expect to feel, what we'll be doing for them to help either prevent certain symptoms or help alleviate them to the best that we can, how we can keep our patients as functional as they can be, so that they can maintain the best quality of life possible, both during their treatment in an acute care type setting and when they go home. Those are all things that nurses have a large role in for our patients.
Yeah, some patients are afraid to ask doctors special questions or unique questions. What might some of those questions be that they feel more comfortable asking you?
It's a good question. Anything personal, I think, is for any type of patient can be difficult to raise with a physician. And I think oftentimes because we as nurses spend so much time with our patients and are often able to develop those relationships where they get to the point where they feel more comfortable talking to us and asking us. I mean, anything from, I feel like this might have been a dumb question and didn't want to ask it, to things like, how is this going to affect my sexual health or my relationship with my partner, those types of questions. And so often it will be the nurse who the patient opens up to about those things. And we can either answer it to the best of our knowledge, or we can be the one to relay that to the physician and get them back involved in the conversation if maybe it was something that the patient at the time wasn't as comfortable talking about. So we often, regardless of what the topic is, we kind of help facilitate those conversations or kind of get the team back together when we think we need someone else's expertise back in the picture, so that we can make sure that their needs are being addressed the best possible.
Right. And it is a team. It's not just you,
absolutely,
doing a thing, Yeah. So let me just test you on some question, or throw out some questions. The patient's, there for, about to spend their first night. You walk in, check on them, do a blood pressure thing or whatever. And the patient turns to you, looks you in the eyes and says, "Am I going to die from this?"
If they're going to die from their disease or their treatment. So that's always a very difficult conversation. And, that's not something for me to give a yes or no answer to. To me, that's kind of a sign that, we need to have a larger conversation again with the team about, what the prognosis is. And sometimes in the beginning, when we don't have all the information yet that we need, as we're still working a patient up and determining, where they are at in their, for example, disease progression. That, once we have all that information, then we can come back together and let our team of providers know, what is the prognosis? What can we realistically expect? And then going forward from there, what nurses have a large part in is ensuring, how are we going to give you the best quality of life that we can.
All right. So around the quality of life, I mean, do you have these very deeply warm and almost you're being honored to the patient is honoring you by asking you, like, I didn't want to tell my doctor, but I'm gay or I'm lesbian or I'm married in a hetero looking marriage, but I've been enjoying sex with Sergeant Bill or something, I mean, are there revelations that are both unexpected and filled with, respect and honor in that realm?
Absolutely. I mean, patients of all backgrounds, all races, sexual orientations, we get to care for everyone. And if those are topics that a patient feels, uncomfortable speaking up about, again, those are things that nurses are always there to help facilitate and help reassure them that, that's not going to represent any kind of barrier to the quality care that they're going to receive while they're with us.
And is it fair to say that there are less time constraints on a nurse than there might be on a doctor for conversations like that?
We certainly keep very busy, and we are running around all the time, making sure that all of our patients are getting the best care possible. But because we are staffed there 24/7, and we can often concentrate on our particular patient assignment at a time on a shift, whereas a physician might be responsible for many, many patients on all different units of the hospital at a single time. That does afford us the time to be able to really sit down with a patient and make the time for those important conversations.
So can a patient best use an oncology nurse?
I think, it's just important for them to know that we are going to be, if not their number one advocate, one of their best advocates in the professional setting. And that whatever it is that they need or maybe confused about or just don't know what to decide or how to explain certain things to their family, that we are as really often at the center of the healthcare team that's taking care of them. We're well positioned to reach out to the appropriate members of our team and come up with a plan to address those needs that they have. So I think just knowing that we are there to be their best advocate for them while they're under our care.
Yeah, and that's an important role. I mean, because they're in bed and not able to go office to office and chat up, the radiation oncologist or
Right.
whoever you are. And you do that. Is that correct?
Absolutely. Yes.
Yeah. So what are the things that you wish patients were more proactive in telling you? I mean, pain comes to mind, but other things. What do you think?
Yeah, we we often do try to facilitate these conversations, but I think it is always helpful when patients or family members are able to articulate, you know, where where they want to be functionally, both while they're with us in that acute care setting and then when they get home, so that we can ensure we are um, integrating all the expertise and things that patient is going to need to be able to reach that quality of life that they're looking to be at, or at least help them get as close to it as is possible for them.
Yeah, and in that respect, I mean, prostate cancer affects older men
Right.
typically. I mean, we've seen people in their late 20s and early 30s with prostate cancer and being treated for. But it's an older male thing, and transgender women. But it's older men make up the overwhelming majority of prostate cancer patients. Do you from I mean, and you've worked with female soldiers and sailors and with who have cancer. Do you see any truth or understanding that men don't speak up as much as women around their health?
Um, Honestly, I it's not necessarily a difference I see in gender, but I think with all service members more generally, you tend to see a lot of stoicism, um, a lot of maybe fighting through uh, certain difficult or painful symptoms where someone different might be more willing to just say very upfront, I'm having a hard time with this. But and that's too why it's so important for nurses to really get to know their patients, know their personality, and really elicit that, because especially when it comes to symptom control, um, we try our best to not let them get to a point where it's now so bad that we're fighting an uphill battle to get it under control. So yeah, I think one trend that I do see in service members is just that stoicism, and maybe just a little bit of hesitancy to say when things are really bothering them.
Yeah, do you see more stoicism or hesitancy among uh, elite troops versus non-elite, like a Navy SEAL versus
Absolutely.
yeah? What's that like? Tell me about it. So
Or
you're laughing. Go ahead.
yes, I it's absolutely true, at least in my experience, that special forces, like you mentioned, Navy SEALs in particular, um, they will fight through anything, and sometimes it's almost a challenge to get them to take something for example, for pain or something like that. So they a lot of times will grin and bear it, and it takes a lot of convincing from their nurses to get them to do otherwise. So
Yeah, and so the counter question might be, why would you, if a Navy SEAL captain or whatever is comfortable fighting through pain, and that's his or her raison d'etre for being a SEAL, and for going through all that training and such. Why might it be important for a nurse or a doctor to try and get them to think otherwise?
Yeah, I think, and we do usually see this, at least I do more commonly when um, a diagnosis or treatment is brand new. And what we try to teach them, is that if you keep letting that go on for a long period of time, eventually it'll really wear you out, and suddenly you will get to a point where you're not able to get up in the morning and do the things that you want to do with your day because you've gotten really behind on, for example, I'll use pain again just because it's so common, getting behind on controlling a symptom like that and keeping it at a place where you're able to um, be able to do the things that you want to do on a daily basis in life and be able to enjoy each day.
Do elite troops generally, uh, do you find them individuals reluctant to talk about quality of life stuff like sexual functioning or urinary continence?
Um, I think sometimes that can be the case, but things like that too are really apparent, or are such a short term have a short term effect or a here and now effect on quality of life. So I think those things are actually in a way easier to raise or talk about or be open about. So
Yeah.
yeah.
What are the conversations that you've actually had that I mean, without being specific, obviously, but, that you've enjoyed having and that you felt this is why I'm a nurse. I've just helped this person because of the chat we just had.
Right. It's the little things. For example, when we know a patient is coming up on a birthday or an anniversary, something like that, getting together and pitching in to get them some balloons or some special food from, outside if they're able to have it, bringing that in, just, making their time in a hospital bed where no one wants to be, um, a little bit more tolerable and special. Those are the moments, that um, really make me happy, and um, uh, show me and my colleagues, remind us why we got into this profession in the first place. So,
So that's super. And, I'm tempted to ask, have you ever had like a grouchy admiral or you just wish we're on some other floor or something? But let's leave well, actually, have you?
I've had patients of all ranks who can be a little bit grouchy, but that's so par for the course in our work. And what we have to remind ourselves as nurses is that, and again, back to, because we do spend so much time with them, we can often be on the receiving end of frustrations, but we know that, it's not meant to be directed at us, or it's not about something that we did, because even when we're going above and beyond, we can still have patients who are um, upset, but it's we know it's not about us. It's about other stressors that are going on in life, and we just have to remember to do our part in helping alleviate those stressors as best we can for our patients.
Well, Lieutenant Fite, thank you very much for this conversation. Thanks for the care that you offer people who serve our country, including yourself. I'm really just don't like saying the cliche "thank you for your service," but really thank you for your service. And we're grateful for both your participation and for your career, as are your patients for sure. Okay, see you around.
Thank you, Darryl. Thanks for having me.
Sure.